BRAF mutant patients given Dabrafenib combined with Trametinib, a BRAF and a MEK inhibitor, and we've got very long-term follow-up, median follow-up of over 30 months, and we're looking at the clinical factors which define those who benefit from these drugs the most. What we found was that LDH drives it. We also found people who had complete response had an excellent 1 and 2 year survival. After LDH though, the next important thing is number of disease sites. And we found that about a third of the total pooled analysis, so this is from 2 phase 3 clinical trials and a phase 2 clinical trial, treatment naive patients given Dabrafenib and Trametinib, a third of those 617 patients actually had a normal LDH at baseline and less than 3 disease sites, and they did extraordinarily well with a 3-year survival of 70%. And that was the majority of patients, over a third of them. So those are the factors that are dictating a long-term survival, as well as those who have a complete response have an extraordinarily high 1 and 2 year survival. So that's what we looked at in terms of who's doing well on those drugs. And then the next thing we looked at was progression. Of those who've progressed, what are the types of progression? And we saw that there are different types of progression. Not everyone progresses quickly. Some people progress quite slowly. Those who tend to progress more quickly are those who develop new brain metastases, or both new growth in both new and existing sites. They progress the most quickly. And then there's a group that might only progress in a new site or just in existing sites. They tend to progress slowly. So in that study we demonstrate different types of progression so that it can help the clinician say, okay, you've progressed, but you've progressed in this way, I need to move quickly, I need to do something else. Or, oh, you've progressed in this way, that's a bit slow, I've got time for immunotherapy. Those sort of questions.